Okay, hi there everyone. Welcome to our clinical student nurse conference with the HIV clinic here in Vancouver. My name is Magdalena, and I'm just going to be facilitating the conference via Skype today. Unfortunately, I couldn't be with you in the office. So we just wanted to cover a few things here just regarding the LGBTQ2S community. So I wanted to make sure that you as student nurses are fully equipped with the clients who you might see coming into this clinic. So LGBTQ2S includes lesbian, gay, bisexual, trans, queer, and two-spirit, which is the term for that some Indigenous people identify with. So I just wanted to highlight on the fact that it's very important as a nurse in this clinic to remain non-judgmental, open-minded, compassionate, and making sure that you're addressing the client's disclosure in a caring way and respecting their confidentiality. So also at that time, you might want to touch on when you might have to pass information on to other healthcare providers, who those providers might be, and just kind of talk about what situations that might happen in. So for example, if there's a risk of self-harm or abuse. So we'll talk a little bit more today about relational engagement with this population, the importance of active listening and things like that. So I'll just pass it on to the nurse manager, Michelle, and she's kind of going to delve a little bit deeper into that for us today.
Yeah, so my name is Michelle. I'm a nurse that works on this clinic for HIV, and you'll see a lot of people in this clinic that identify as LGBTQ2S. And so we wanted to kind of bring this workshop together so that you are able to answer your questions and that you can feel like you are equipped to interact with this community. Does anybody have any questions to bring up? That is your preconceived ideas of what it will be like?
This question is about gender versus sex. I know that there's gender fluidity and that it's important to acknowledge that. But when looking at some of the physiology of HIV, like I know that women have a higher viral load and that can affect the treatment options. Like how do we kind of navigate between sex and gender?
Definitely, because the difference between sex and gender, as you've probably learned before, is that sex is kind of your biological, what your body is made up of, whereas gender is more of the cultural or social context that the person will identify themselves as. So for medications and medicine, we have to kind of keep the sex in mind of how their cells are going to respond to some medications like that, but also socially and how we interact with them, you have to have that gender context as well of being really respectful of how they would like to be addressed and having a very safe place for them to come to.
That makes sense. Yeah. I was just wondering, I know some individuals that may come into the clinic may go by a different gender or sometimes different pronoun. So how do we know as a nurse what they prefer to be, what pronoun they prefer to be used?
Yeah, that's a very good question, Rachel. There's what we try to do is when we walk into their examination room to be really open about it and say, hi, I'm Michelle, and how would you like to be addressed? And just so that they have the choice of whether they would like to be addressed as he, she, they, it. It depends on their preference for that. And also having them know how they would like to be addressed in their name, as well as certain pronouns that you would like them to be referred to as.
Okay, thank you.
And what other things do you think we should be aware of when interacting with people in this community?
Things to be aware of is a lot of people in this community can have past trauma from healthcare providers that have not been so open-minded or have passed judgment on them. So it's good to be aware of their trauma that they've experienced in the past and to really show compassion and show that you have a very non-judgmental stance and be really human with them. And that's kind of how you can use your relational engagement skills to really connect with this community and make them feel safe.
Absolutely, I agree.
Awesome.
Great. Well, thank you so much for covering those important topics, Michelle, and thank you to the students for the great questions.